Our first segment is on pre-implantation genetic diagnosis, a procedure that identifies health or disorders in very early stage pre-embryos. PGD was first reported over a decade ago in England. Now, over 1,000 documented live births have been made possible through use of this procedure, with many ongoing pregnancies in the United States and the world. Here to explain is Dr. David Hill of Southern California Reproductive Center in Beverly Hills.
Pre-implantation genetic diagnosis. It is a technology that we use now to determine the genetic status or health of embryos before we put them back in a woman after in vitro fertilization. In a clinic for assisted reproductive technology, which is really what we are, the typical patients are people that can't conceive. If it's only been a year, those couples are fortunate that they've been referred to us. We can quickly come to a conclusion as to why they're not getting pregnant and then go from there. Now, pre-implantation genetic testing is a field that grew not necessarily out of reasons for infertility. It grew out of reasons of couples that had a baby born with birth defects, and they wanted more children, but they didn't want to have another affected child, for example, cystic fibrosis. So what we're seeing now is we're seeing couples that are not just coming to the clinic because they're infertile, but because a clinic such as ours that treats infertility is required to do pre-implantation genetic testing, because a couple, even though they're not infertile, need to take fertility medication so we can create several embryos and test them for the patient. We take a cell off of each one, doesn't seem to damage the embryo in any way, and then we analyze that cell. So we can then tell you which embryos are healthy, which ones may be affected with a genetic disorder, or the sex of the embryos. Now there are probably 300 to 400 different genetic disorders that can be determined by embryo biopsy. This technology was not developed to design babies. It was designed to enhance health of offspring, and I think that that is what you're going to see as the years go by, a refinement of the technology, the ability to improve upon the health of infants. Day 3 human pre-embryos are made up of about 8 to 10 cells. Any of those cells could either continue to develop to become a baby, or could become the placenta, or any other amniotic membrane that comprises a pregnancy. Therefore, I would submit to people who are watching that pre-embryo is the appropriate term. They are due much more respect than any somatic cell or any other cell of a body, a finger, a piece of tissue per se, because they absolutely do represent the new potential for a human life, but they are not an individual by day 3. The mission of every Center for Assisted Reproductive Technology like ours, the world over, our primary goal is family building. That's what we do, and we do it as well as we can.